Hello, let's learn about sample collection, storage, and transport for microbiology testings. Collect a sample from the correct anatomical site. That is, superficial sample of a lesion is not useful in identifying the cause of infection. The timing of sample collection is also important. When submitting a specimen for bacterial cultures, samples should be collected before the administration of antibiotics. Collection techniques should be sterile with sterile equipment. Sufficient volume of the specimen should be collected. After collection, the specimen must be placed in appropriately labeled leak-proof container. Each specimen must be accompanied by a requisition slip to evaluate the specimen appropriately and relay the test results back to the healthcare provider without delay. The requisition slip should contain the information such as name, age, gender, identification number, location, name of the healthcare provider, time and date of collection, specimen type, diagnosis, and test requested. The transport of specimens should be rapid, optimally less than 2 hours. For delay in the transport, most specimens should be refrigerated at 2 to 8 degrees Celsius. Exception, for example, blood and sesa should not be refrigerated and should be kept at room temperature. Specimens to be examined for anaerobes and fastidious organisms such as Neisseria gonorrhea, Bordella pertussis, and Trichomonas vaginalis, all of which should be maintained at a room temperature, that is 37 degrees Celsius. Specimen rejection criteria includes improper transport temperature, improper transport container, prolonged transport time, unlabeled or mislabeled specimen, broken or cracked container, and leaking specimen. It also includes dried out specimen, inappropriate specimen for test requested, inadequate volume, and specimen ineffixity. When specimens are rejected, the healthcare provider is notified so that another specimen may be properly submitted. If information on the requisition is incomplete, lab personnel should ask a responsible person to provide the information before processing the specimen further. If a specimen is mislabeled, the sample should be recollected. Relabeling of a specimen is acceptable only for difficult to collect specimens such as tissue obtained from a surgical procedure or CSF. Specimens which are not routinely accepted for anaerobic culture include throat swabs, gingival swabs, nasopharyngeal swabs, sputum, then bronchial washing, lavage or brush. Gastric and bowel contents are not accepted for anaerobic culture. Ileostomy and colostomy effluent are not accepted for anaerobic culture. Voided or catheterized urines are not accepted. Female genital tract specimens collected through the vagina are not accepted. Surface swabs of ulcer, wounds, and abscesses are not accepted. All specimens should be presumed to contain transmissible agents and therefore should be collected and handled using standard precautions. Use of gown, gloves, masks, and protective eyewear whenever there is a risk of coming in contact with the specimens. What are contact precautions, droplet and airborne precautions that must be followed while doing sample collection, storage, and transport? This includes, for example, contact precautions include wearing of gown and gloves. Patient known or suspected to have serious illnesses transmitted by direct contact, for them the contact precaution needs to be followed. Patients with droplet infections such as diphtheria, pertussis, meningitis, herein droplet precaution needs to be followed, which includes contact precautions plus well-fitting mask and eye protection. Patient with airborne infections such as tuberculosis, therein we have to follow airborne precautions, which include contact precaution, droplet precaution, and an entire respirator. How the clinical diagnosis is made by microbiology laboratory method? It's by direct examination of the specimen, gram staining, acid fast bacillus staining, KOH mount, and calculoflush staining or weight mount. It also includes isolation, culture, and identification and sensory testing of the sample. A combination of various media methods are used to isolate the bacteria and the fungi. However, the viruses can only be cultured between mammalian cells. There are three main categories of virus cultures. This includes primary, low precision, finite, and continuous cell lines. Culture of parasites is generally not performed. The clinical diagnosis also is affected by the length of the culture time. Most routine bacterial cultures are incubated for 4 to 7 days. Microbial and fungal cultures are incubated as long as 6 weeks. Viral cultures are incubated for varying time depending on the specimen source and the growth rate of the viruses and are typically recovered from that site. The clinical diagnosis of microbiology is also affected by the condition of incubation. The temperature is 37 degrees Celsius for bacteria and viruses and 25 and 37 for fungi. Various atmospheric conditions may be utilized, such as carbon dioxide environment or a micrographic environment or anaerobic or enriched environment for the microbiology testing. What are the specific recommendations for each specimen type? For blood culture, blood should be collected by venipuncture of peripheral veins or arteries or from intravascular catheters. Palpate the vein and then disinfect the venipuncture site and the stoppers of the culture bottles and collection tubes prior to blood collection. Note: do not use iodine to disinfect the stoppers if bacteria alert bottles are used. Clean the site with 70% isopropyl or ethyl alcohol. Swab concentrate starting at the center with 1 to 2% of iodine or 10% protein iodine solution. If the patient is hypersensitive to iodine, prefer the skin by using a double application of 70% alcohol. Allow the disinfectant to dry. Do not palpate the vein after disinfecting the skin prior to inserting. Drop blood through a syringe and needle and inoculate into the bacteria alert bottle. Dispose of the needle in biohazard stock container. Do not reuse the needle. Specimen should be collected before administering antimicrobial agent. Optimal specimen should be collected just before a fever spike. Inoculated blood culture vials should be held at room temperature until they reach the laboratory. For acute febrile episode, 5 to 10 ml each from the two peripheral sites or within 10 minutes prior to antimicrobials should be collected. Endocarditis 5 to 10 ml each from the three peripheral sites within 1 to 2 hours before antimicrobials is collected. For fever of unknown origin, 5 to 10 ml each from the three peripheral sites more than 1 hour apart during the 24-hour period, it needs to be collected. If it is negative at 24 hours, again obtain 10 to 20 ml more blood. The blood cultures are drawn from lines, and accompanying peripheral culture is essential because of the higher contamination associated with the line collections. For pediatric blood collection, it depends based on the weight, like 4 kg or 4 to 29 kg or 9 to 27 kg or more than 28 kg, we have required blood volume accordingly. Collect immediately and rarely necessary to document the continuous bacteremia with hours between cultures. Collect the blood volume based upon the patient weight, not on the age. Cultures for rapidly growing bacteria and yeast are usually incubated for 7 days. Cultures for mycobacterium fungi are held for as long as 4 to 2 days. Many types of blood culture systems are available, such as manual and automated. Each system utilizes a non-invasive method, such as colorimetric method or fluorescent method or manometric method for detection of the gases, such as carbon dioxide, to monitor the growth. Detected from the blood, a stain is performed, that is gram staining or A-based staining or gym staining, to determine the microorganism present. Positive stain results are considered as a critical value and it is immediately informed to the clinician. Then the specimen is subcultured to solid. Regarding the collection instructions of catheter tips, clean the skin around the site with 70% alcohol. Aseptically remove the catheter and clip the 5 cm dip of the catheter into a transport container. Place sample in the container. The segment is rolled across the blood agar plate 4 times when it reaches to the microbial laboratory. It is performed to determine the source of bacteremia. We'll see in details about sample collection in my next session. Thank you.